Hey, this is Dr. Cory Glenn with Blue Sky Bio, and I'm going to be showing in this video how to do just a routine guided surgery case for a simple lower left first molar implant using Blue Sky Plan, but I'm going to be showing this using the Wizard. And so one of the things you might know about Blue Sky Plan, if you've played around with it much, is that it's an incredibly large, very robust software, but because of that, there's a lot in there to learn. So there can be somewhat of a learning curve. So our answer to that has been to try and develop these wizards that lead you through the process so that you don't necessarily have to have, expert level capabilities on the software. You can instead just use the wizard and it will lead you through the various steps to execute a guided case. And so let me just work through one of these. And we'll start that by clicking on the Start Wizard button, which is in the upper left. Now the first thing it's going to ask us for is the type of STL that we're going to be using in this case. So for background, there's two pieces of information you have to have for guided surgery, and that is a DICOM, that's the cone beam of the patient, and then your STL model. Now that STL model can come from various sources, and that's what this first box is asking for. A model STL, that's simply a digital model, right? So let's say you have some type of a scanner in office, maybe a desktop scanner like the Shining 3D, and you scanned your stone model and it generated an STL. That would be this option. Some people don't have any type of an optical scanner, and if that's the case, you can simply take a PVS impression or just pour up a stone model, and you can actually cone beam scan that. And Blue Sky Plan will turn the DICOM of that impression or of the cast into an STL. And so that's what either of these two options would be alluding to. That would be a CT of the impression or a CT of the model. And the last one we won't hit on too much. This is more for a scan appliance, a little bit more advanced technique that we can cover in another video, but it would be an impression that has radiographic markers on it. This is a pretty straightforward case, and I find most cases people are just using a standard STL from a scanner, so we'll choose that. And we also, at this first step, need to identify which kit type that we're going to use. And so I'm going to go with the Blue Sky Bio fully guided surgical kit. As you can see, there are many different kits that we have in the software. Choose whatever you want, but I really do think that this fully guided keyless kit is one of the best on the markets. So click OK, and the first step once you click OK is it's going to ask you to upload the DICOM data of the patient. So this is going to be a file that I will make available in the comments section of this video so that you can actually work through it and try it for yourself. But this is going to be called Case 1 DICOM. We'll click OK. And the first screen that's going to come up is the screen where you can set your field of view. And the reason that's important is because you'll see this is a very large field of view machine, which means there's lots of data to this, and it's really greedy on your computer to render all this. Not to mention, there's nothing that is in the base of the skull that alters my treatment plan of a number 19 implant. So let's eliminate most of that data so that it doesn't bog the computer down and it's not obscuring our view of other things because of such a large model. So when you do this, the first thing you should always do is to parallel the occlusal plane to the floor. So if there was a cant, you can grab the blue ring, parallel that to the floor, and just in case you can't see, what we're looking at here is this is the level of occlusion, maxillary sinus, orbit. If you look in this window, maxilla, mandible, eyes, airway, spine, base of skull. So we've paralleled the plane of occlusion here. We would also, in this view, this is the one that more commonly needs to be moved because sometimes the patient's chin may be too far down or too far up. Again, parallel this to the floor. And then once you've done that, now we can grab the yellow arrows and let's slide those down. And I'm gonna not try to go cut off the entire maxilla. Again, I'm working on the mandible here, but I'm gonna cut the majority of it off. I really only need to see the opposing dentition. I don't need their sinuses or anything like that. The distal arrow slider, I'm gonna limit that to about the airway. So you can see this dark line, that's the airway. There's really nothing behind that that alters anything about my treatment plan. I don't need the soft tissue of the nose, so I can scoot that in. I don't need the soft tissue of the cheeks, so I can scoot that in. And again, the idea is that this is just going to limit the amount of data that the software has to crunch during the rendering process, so it'll speed things up overall, especially if you've got a computer that's borderline on the specs that you're running. Okay, so the next step is that it's going to map the nerves. Now you can see right now there's a crosshairs with an N beside it. This means it is ready to actively map a nerve. And what you're seeing with this yellow plane, if I scoot out a little bit, this plane corresponds to what you're seeing over here in your cross-sectional views. Okay, so right now it's asking to detect the right mental foramen. Now this is actually a case that's on the left side, so we don't really need to do this, but we'll do it just to demonstrate it. Basically it tells us the tip here, and if you're ever lost, there's a video as well as a tip, so we're trying to make this as easy as possible for you. And it simply tells me click in the mental foramen and the nerve will be detected. Okay, so I go and I scroll through until I see the mental foramen for the right side, and I'm just going to click inside of it. And as you see, it maps the nerve. I click next, and the next step is to detect the left mental foramen. Let's repeat the process. Let's scroll around until we get to the left mental foramen. So again, there's the visual indicator telling you where you're at, and I'm getting close, and right there you see the mental foramen. I can zoom in here a little bit. So you would just drop your point right there. So we'll click inside of the mental, and now both nerves are mapped. Very fast and efficient way to do this. Now you can also go back and edit this if you need to. So let's enlarge this window and simply scroll through. Now you'll see that the nerve is demarcated by this yellow outline, but then there's also periodically these white nodes. The nodes are actually something that you can grab and move around. So what I like to do is just scroll through here and let's track along this and see if it's off kilter anywhere. So here it looks like maybe a tiny bit it could be moved mesially. There's another node, that one's perfectly in position. There it's perfectly in position. So if you need to alter it, you can do that. This is a good point to tell you that there are occasions where this wizard workflow may not work. Okay, so 90% of cases it's going to be perfectly fine for routine implants, but there's sometimes complicating factors that may make these automatic functions not work as well as you'd like. On the nerve, for example, have you ever seen a hollow mandible where the patient's got really dense cortical bone, but there's really nothing on the inside of the mandible? In cases like that, there's not a well demarcated cortical boundary to that inferior alveolar canal, and thus the software is going to have a difficult time mapping that. And so that's an illustration of a case where you would have to potentially revert back to the more advanced functions. So I will also have a link in this video to a video that illustrates how to use the advanced functionality in Blue Sky Plan, so that if you have one of those rare cases where the wizard doesn't work, you can revert back to that. Okay, so our nerves are mapped. We can click next, and the next thing it asks us to do is to upload your STL file. Okay, so once again, this will be available in the comments section. It'll be a Google Drive link, and I can click OK. This is case 1 gingiva. And this is a new feature. This is the automatic alignment function, and this is so much easier than the way we had to do the STL alignment historically. In fact, that was one of the hardest things for people to grasp as they're getting into guided surgery, and it was also the absolute most important thing that you nail, because if you don't get a good merge between your STL model and your DICOM data, none of the rest of this matters. You're going to have an inaccurate surgery. So very important. And now this is as easy as simply choosing which jaw and then OK. And as you see here, the software has automatically merged this. We can enlarge any of these windows by hitting the upper right corner. And what you ought to see as you scroll through this is you ought to see this model outline. Here it's yellow, tightly adapted around the DICOM data. And so this looks like a very good merge. And again, this works in the vast majority of cases, but if you have a case that for whatever reason this is not lining up, maybe it's from too much scatter. One other thing I've seen that can cause the auto alignment to fail is sometimes you might have an enormous base on a model, and that provides all of this extraneous data that doesn't really have anything to correspond to on the jaw. So in my experience, it's better for you. You'll have more successful merges if you simply limit your STL model to roughly the dentition and a little bit beyond. We don't need the very depth of the vestibule on something like this, and that will help your automatic merges because the teeth are really what's being used to merge this. So if you needed to manually adjust something, you could come up here and hit manual alignment, but at least what I'm seeing on this case looks like we've got an excellent alignment, so there's no need for us to do that, and we can click next. So the next step asks us to identify a tooth. Remember, implants are generally a prosthetically driven discipline, and so we need to put a tooth in because that's what we're trying to create at the end of this process. So choose the implant you want to use. There's any number of implants already in the system. I'm using, again, the Blue Sky Bio implants. I'm going to choose the Bio Max, and you can choose your platform size here. So I'm going to go with a 5mm wide implant because this is a really large ridge, and a 10mm length. Even though you could put a 16 in here, there's really not much value in an integrated implant being any longer than 10. It simply raises your risk, raises your blood pressure during surgery. There's just no need for it. Okay, so I'll click OK. And you can drop this into any of the views. As you notice right now, there's a crosshair and a tooth beside my my mouse, and I like to do this on the panoramic view. Okay, so I just enlarge that. I'm going to click here, and now the tooth and the implant are going to be linked together. So I can move this around. If I simply grab the red of the tooth itself, you're going to see that I can bodily move this around. If I grab the rotation widget, that's going to enable me to rotate this. So I usually start out in this panoramic view because this is going to enable me to parallel the roots. So if you think through your rules of implant placement, typically you want your implant to be paralleling the adjacent roots, and right in between them. You're going to want to make sure that you have 2mm of bone on all sides of the implant whenever possible. Obviously, you want to make sure that the screw hole emergence or the screw access would be coming right through the center of the crown whenever possible. All the typical things that you would look towards with a routine implant placement. So I'm looking in this view. I like the tangential view. That's this one right here. Now the reason I like this view is that because just by rotating the scroll ball on the mouse, I can spin this implant on its axis and look at it from every different dimension. So I really like that view for placing the implant, but for placing the tooth, you're better off just doing this on your 3D model. So again, set your tooth up where it's in the right position relative to the space. All right, you can grab any of those widgets and rotate it. So if I wanted to tilt it this way a little bit, I can. If I wanted to move it laterally, I can do that here. I'm just pretty much looking to line up the central groove and then the cusp heights to be the same. This tooth is a little small for the space. If you need to stretch a tooth, you can stretch it in a lateral view by grabbing this pink node and stretching it outward. If you needed to stretch it in a vertical node, you could grab the blue one. So now we've got the tooth in place, and we can click next. Now this step, you saw in the previous step, the implant and the tooth movements were coupled together, right? So in an ideal world, all our patients would have a mile of bone, and exactly where the tooth belongs, we could have the implant perfectly placed below that. That is almost never the case, and so this step decouples the tooth from the implant and enables you to now fine-tune your implant positioning. So the tooth is in the right position now, and I can look at this and now make individual tweaks to the implant. So as you see, it's decoupled its movement now. And for the implant position, with the Biomax at least, because it's a conical connection, I'm usually shooting for 1 millimeter subcrestal. Again, I want 2 millimeters on all sides of my implant, which this patient has a ton of bone. I want the screw access hole, or the trajectory of the implant, to be emerging right through the center of the prosthesis I'm proposing. And so this is looking like a nice proposal here. And once you've got the implant in the proper orientation, you can click Next. Now we're ready to draw the guide, and so at this point you notice that the software has automatically positioned the guide tube, and remember, it knows to do that because we told it in the very first step which surgical kit we're going to be using. And so it has pre-programmed the guide tube, the offset, all of those things have been pre-programmed to accommodate the Blue Sky Bio fully guided keyless kit. So you can see this step is to draw the guide curve. That means drawing the perimeter of where you want this guide to be. The way you do this step is to do what the tip tells you, which is hold down Shift plus your left click and draw your curve. So if I hold down Shift, you see my mouse go from an arrow to a crosshair. And now if I click and hold my left mouse button, I can begin drawing the outline of this surgical guide. Now at some point you run out of space and you need to reorient your model. Just let go of your Shift button, rotate it around where you can see again, and pick up where you left off. It's not important that you pick up exactly on the tail end of the last line. In fact, that can almost be problematic if you do that, because you can make this line cross over itself. So if I left off right here, I'm just going to pick up somewhere close to it, but not overlapping, and continue on. All right. Every time I need to reorient, I'll let go of the Shift button and then just continue on. And your guide boundary typically needs to be right at about the level of the CEJs of the tooth. And so after you've drawn your curve, you can click Next. The next step brings up these nodes where you can fine-tune the positioning. And so on this, I would bring the buckle extent of this to where it's not so far down, because the farther down that is, the more you're going to have to flap if you're doing surgical flap. So again, I'm typically looking for something that's right in line with the CEJs of the adjacent teeth. This looks good, and so now we can click Next, and the software is going to begin fabricating that surgical guide based on this curve and where the guide tube is. And here you see that the guide has been generated. It follows along with the curve that we've indicated, and so we can look this thing over and confirm that it's okay. There's really nothing you got to do at this point other than click Next. So when you click Next, it'll give you the opportunity to save your guide. I'm not going to save this one right now. Actually, you know what, I will, just so you can see the entire process. Let's go on our desktop, actually in our documents, and I will just save it here. So click OK. And I don't really need to do this. I'm going to say don't send now. And the software also generates what's called a drill report. Now this is very useful. I don't know about you, but when I'm in the middle of surgery, I don't want to have to deglove, and if I forget how far I had to the nerve or whatever, I don't want to deglove and navigate through a CT. What's really nice is that these drill reports get automatically generated, and this is kind of my plan of attack. I tape this up behind the patient, and it automatically generates and tells me what my drill sequence is, which handles I'm using, what depth I'm going to, and then a bunch of auto-generated pictures that tell me where the implant was positioned. So this way I don't have to deglove. I tape this up actually behind the patient during a procedure and just have it there as a reference. So if I need to visualize how far we were from the nerve, I can simply look at this picture and say, oh, I've got a mile to the nerve. A lot of space in this one. If I needed to see its position relative to the mental foramen, well, here we go. It tells you what tube to use. It tells you the implant that you were going to use. Maybe you planned this 2 weeks ago and didn't remember all of those things. You've got it right here for a reference. Okay, so I'll minimize that. We can now say open the folder where all of that has been saved. And here's our surgical guide. Now, just so that you see this process through to completion, I'm going to launch the 3D printing software that I use. So I'm a big fan of the Moonray 3D printer, and the software it uses is called Rayware. So this is what it looks like. It's a very simple software, and all you would now have to do is grab your surgical guide STL and drag it over. Alternatively, you could come and hit the plus and then navigate through and find that file in your folder. And once you've got this, you can position this. Now, we don't want the intaglio down towards the table, because that's going to put supports up into the internal of this, and all have to be adjusted out before this will fit properly. So I always orient this laying in this manner as you see here. If you had a lot of prints to do and we're trying to fit a lot on the build plate, you could print it, it'll print slower, but you can fit a lot more on the build plate because this takes up a much smaller footprint. But I'm not going to do that. I'm going to lay it flat and build supports under it. So I just hit generate supports, and this is now ready to print. Now, I'm not connected to my printer at the moment, but I would simply put in surgical guide resin. I'll always print at 100 micron of resolution, and you can see that oriented this way with that particular resin on this particular printer, we're looking at a 44-minute print time, so not a big deal at all. Back to our software, the last step is to save the guide, get your case report. We've done both of those, and finally we push next. And we're no dummies at Blue Sky Bio. We're going to help you make this as easy as possible. So we're going to automatically load the selected items, the implant that you needed, the proper metal guide tube. If you needed the kit, that gets automatically generated. So all of these things get uploaded to Blue Sky's website, and you can simply go to your cart now, check out, and you're done with the process. So we've really tried to make this as easy as possible. And again, this works for the vast majority of simple cases. Going through this wizard, and at this point you could say close the wizard, and it just takes you back to your base home screen, and you can reopen this file at any time. You can look back through it, you can add more screenshots, anything like that that you want to do. But the goal with the wizard is just to make it as simple as possible, where you don't need to be an expert to do this. It just leads you through the process. So again, if you get lost at anywhere during the process, look at the tip in the upper right, and you can even click on the embedded video so that you have a reference. And hopefully you'll find this to be an efficient way to make your surgical guides.